Hey guys, Dr. Blackman here. We're going to go over the male reproductive system model. Okay, we start out here with the testis or testicle, where sperm are produced. Okay, the testicle is housed in the structure called the scrotum, so that it can be outside of the pelvic cavity, so that the sperm will survive at that lower temperature. Okay, this structure on top of the testicle, where sperm go to mature and be stored, is the epididymis. The sperm then travels along this tube out of the body. That's called the vas deferens or the ductus deferens. That's what's cut here if you have a vasectomy, a sterilization procedure. Okay, the vas deferens plus these blood vessels here, nerves, lymphatics, etc. Right, as it travels from the pelvic cavity down into the scrotum, there's some muscles in there as well. That's called the spermatic cord, sort of collectively. Okay, this structure here, there's one on each side. It's bilateral. It adds nutrients and other material to the sperm to make it semen, so that it's more likely to survive. That's called the seminal vesicle. Okay. Similarly, this is the prostate gland, which also adds secretions to sperm. For example, to make the sperm swim better, using its flagellum. Okay, we often hear about the prostate gland because of prostate cancer. Okay, some other structures here: the external genitals. There's the penis here, the distal tip of the penis here is called the glans penis. Glans being spelled G-L-A-N-S. There's no D in it. The foreskin, the other name for that is the prepuce. Okay, and that's removed in a procedure called a circumcision that you've probably heard of before. Okay, so if we take that off and look at the structures underneath, okay, some structures that are also in the female reproductive system, mons pubis here, pubic symphysis or symphysis pubis, the cartilage that's between the two hip bones anteriorly. Okay, here's the urinary bladder, by the way. The rectum, anus, part of the digestive system. Okay, the vas deferens that we just talked about, it enters this way, right? So the tube here through which sperm as well as contents from the seminal vesicle, and it empties into the urethra here, right? That little tube or duct there is called the ejaculatory duct. Okay, we already talked about the prostate gland here. You can see what travels through the prostate gland, right? The urethra. So as you can imagine, if that prostate gland gets enlarged, right, because of cancer or because of benign enlargement, which we call BPH, that can put pressure on that urethra, and older men, let's say, might have trouble emptying their bladder because of that enlarged prostate. Okay. A couple of other structures that I want us to be familiar with. Okay, we saw this before we removed the detachable piece. There's the testicle or the testis again. Right, here's the epididymis, which we talked about. The scrotum, right? This would be the spermatic cord again. Right, here's the penis with the glans penis. There are columns of erectile tissue located in the penis that fill with blood during an erection. Okay, this purple erectile tissue here, okay, that's called the corpus cavernosum. Okay, it's large, and there are two as opposed to one. Right, it fills up with blood, like I said, to cause an erection. This erectile tissue here that is smaller, and there's only one of these as opposed to two, that's called the corpus spongiosum. And as you can see, it surrounds the urethra, and essentially what it does is it makes sure that that urethra stays open during ejaculation. Okay, so again, corpus cavernosum, corpus spongiosum. Okay, This very small structure here, I was sort of looking for it, it's kind of hard to find. This structure here, which like the prostate gland and the seminal vesicle, it adds things to sperm to make it semen, okay? That's called the bulbourethral gland, okay? And the other name for that is the Cowper's gland, Cowper''S, okay? It actually also releases a mucus-like material for lubrication during sexual intercourse.